COVID-19 vaccines have been available for the last 2.5 years. Millions of Americans have gotten their shot, and a very small group of them face dangerous side effects and their looming cost. For one family, the cost was thousands of dollars in medical bills, a promise from the government to get them paid. 2 Wants to Know's Kevin Kennedy shares the years-long effort for reimbursement.
With the courage of our doctors and
who can forget?
These are tough directives.
A government lockdown, businesses and schools closed, a pandemic invading our borders and life, a government divided, scrambling for solutions, pharmaceutical companies rushing to produce and distribute a vaccine. Millions of Americans lining up to get the shot, the Moore family not hesitating.
We felt it was also important for us to do our part to not only protect ourselves, but protect everybody in our community and whoever we might come in contact with when we're out and about.
Like many people, the family went again, getting a second shot a couple months later. Jonathan was 23 and in good health at the time.
I was under the assumption of better safe than sorry.
The vaccine creating a ripple effect. Businesses back open, schools filled with kids, our country back to some form of normality. But for some of the millions who got the vaccine, there was a problem.
It is without a doubt the worst pain I've ever felt in my life.
2 days after the second dose, Jonathan is in distress.
He woke us up early in the morning, again, chest pains. This time he was violently throwing up.
An urgent care visit, an EKG taken. Jonathan rushed to the ER.
She said, I have to tell you the EKG, as I read it now, shows that your son is having a heart attack.
Doctors would stabilize him. The diagnosis, myocarditis, an inflammation of the heart. 3 months of medications prescribed.
I was concerned that it was going to be something long-lasting or that would have a major impact on my health.
Now, more than 2 years later, Jonathan is in good health, but the family is still dealing with what happened.
We have this huge bill that we're stuck with, and how are we supposed to pay it?
The medical bill's running upwards of $14,000. After insurance, the balance is around $4,000.
Obviously, this free vaccine is no longer free for us.
Cone Health not waiving the bills, but assisting the family, quickly providing documentation to file a claim with the government. Randy submitting the paperwork.
Since that time, I've been waiting and waiting to hear from the government.
The Countermeasures Injury Compensation Program set up to provide compensation for an injury because of a countermeasure. In this case, the vaccine.
It's not like I'm trying to push something above and beyond. That's what this program is all about.
A program that didn't seem to be working. 2 years after filing a claim, nothing. Randy and Karen paying the $4,000 in bills themselves.
I'm not sure I can say I'm optimistic. Right now, I kind of feel like it's taking so long for a response.
We continue to email and call CICP. Randy also calling then Representative and now Senator Ted Budd, convinced the bill should be covered.
That's what it's there for. It's designed for that, and I think we fit in that category.
This case seemingly lost in bureaucratic red tape, but we didn't stop trying to get answers. Neither did Ted Budd's office.
I wasn't getting anything. So that's where I felt like, well, this is my best bet. But I guess coming from his office, it maybe put a little more pressure on.
Maybe it did. In April of this year, CICP left Randy a voicemail.
We couldn't understand if he said your claim has been terminated or determined.
An email confirming the outcome. CICP will cover the bills.
I was amazed just because they covered all the costs. In the end, the total cost they paid was almost $4,000.
Many cases take time, this one topping the list, but in the end, it all worked out. A 2-year journey now over. Kevin Kennedy, 2 Wants to Know.